The projects that were established earlier this year are aimed at providing supplementary nutritious food to children and adolescents living with HIV/AIDS when they come for their medical checkups and during their monthly meetings. About 90 teen club members from the surrounding villages are currently benefiting from the two projects. Speaking during the inauguration of the two projects, Ohangwena Governor Walden Devashia applauded UNICEF for their continuous support.
This is the only first facilities we have in the region, tailor-made specifically for the teen club program in the region. Ohangwena region is extremely thankful for your support. In fact, we are not only thankful for the garden chicken project, but we are also very thankful for the support, for supporting us with financial resources that have been used to establish these resources or these projects.
Former President Hifikepunye Pohamba, who is also from the same constituency, was in attendance. He acknowledged the good relationship between the government and the United Nations Children Fund. Speaking on behalf of UNICEF was country representative Frauke de Kort.
One of UNICEF's mandate, especially during challenging times such as now the past 2 years under COVID, has been to ensure that children and families living in poverty, including those affected by HIV, are linked to social assistance and food support schemes, and hence are gathering here today. The garden we are handing over today demonstrates the good that comes out when we all work together. This initiative aims to produce vegetables and chickens to increase food security, especially to those from food insecure households.
Being young and HIV positive sometimes can be mentally and physically challenging. Thus, UNICEF, in collaboration with the Ministry of Health and Social Services, in 2010 established teen clubs in all health districts countrywide. Teen Clubs intervention was introduced to improve retention in care among adolescents living with HIV/AIDS through psychosocial support in a peer group environment. Speaking on behalf of the beneficiaries, the Namibian adolescent treatment supporter stationed at Hamukoto Wakapa Clinic, Martha Moses, commended UNICEF for the generosity towards their well-being.
This garden has assisted us in many ways. Back then, most of the children were not adhering to their medications when they come to the clinic for their follow-ups. Some did not have the courage to take their medication as they usually used to take them on an empty stomach. But now at least we are given meals before taking our medications. We really thank the government, because if it wasn't for this garden, some of us would not be alive.
Currently, the garden is producing spinach and tomatoes, while the poultry project produces chicken and eggs.